Hi, my name is Stuart Mott. I'm the inventor of cushion cannulation, and I'm about to show you the techniques for how you as a self-cannulator can cannulate, and also how a technician that can cannulate using this technique. The gentleman sitting here has two pillows underneath his arm to elevate it up so he's very comfortable in the positioning of cannulation with the needle. The patient will use touch cannulation and bring it over to here, and you see his arm is resting on his arm to cannulate with. That way he's very comfortable sitting here. He's not putting any extra pressure on his arm and stuff, and he at the same time will have a rubber ball or a tourniquet up here as needed for his cannulation. This is cushion cannulation with another person cannulating the dialysis patient. As you see, the arm is extended all the way out on the pillow. That makes his vein straight. He will make a fist, which hardens this up, and you may need to use a tourniquet, but you can see how easy it is for a person sitting down to cannulate into it. Your eyes are right here. Instead of standing up and coming in an angle like this, you're right down here where you can see what's going on. Okay, now his access comes down here. He has a buttonhole for his venous up here, but it drops off here to the inside. So you cannot use touch cannulation without some type of support. And this here is what we use. This is a styrofoam piece. You can get your styrofoam off of cooler lids and cut them up to whatever dimension you need to get in to cannulate. This particular one fits perfectly for this patient. So what you do is you put a cover over the top of that in case something happens, and then you sit down and touch cannulation. Your finger, thumb and forefinger go around the tubing, you lift it up and curl. You bring the base of your hand over and drop it down. You push this down to the spot that you need to be cannulating at, and you put it in. Then on the top one there, you don't need this anymore because the fistula is running straight up and down. Same technique, wrap your hands around, tip it over, and push it in. Now his wife, who does all the cannulation, will be cannulating, finish this up with him laying down in bed, but using these same techniques.